Hello, today I will talk on the topic injuries. This video is for grade 9 students. This video may be paused wherever you feel that you need time to understand any concept. The learning objectives of this lesson. In this chapter you will learn about the causes and symptoms of minor injuries, ricer treatment, sprains and strains, procedure of ricer treatment for minor injuries. Injury. In daily life, you are constantly exposed to various situations where you may get injured. Similarly, when you practice a physical activity, the risk of getting injured is also present, but if you take appropriate preventive measures, you can easily avoid it. Some ways to prevent injuries. 1. Warm up and cool down properly. 2. Use appropriate clothing, footwear and protective equipment. 3. Abide by rules and regulations of the game. 4. Do not participate when overtired, sick or injured. 5. Adopt correct posture and handle equipment with care. 6. Ensure that a teacher, coach, responsible person is always present. 7. Check if playing surface, facilities are safe to use. 8. Participate at the right level. Choose a team which match your level of skill and physique. First aid. First aid is that initial assistance or treatment given to a person who is injured or suddenly ill. Some common injuries are fracture, dislocation, sprain, strain, bruise, blister, cut, abrasion. Treatment for minor injuries. Ricer is most commonly used procedures for treating minor injuries. It stands for R. Rest, I. Ice, C. Compression, E. Elevation, R. Referral. Rest. During rest you should stop the activity immediately. Sit or lie down in a safe area. Its benefits. It prevents further injury. It helps you to evaluate the severity of the injury. Ice. Wrap ice in a piece of cloth or plastic and apply it around the injured area. Its benefits. It helps to slow the internal bleeding and swelling by narrowing the blood vessels. Compression. Use a clean piece of cloth or bandage to wrap the injured area. Its benefits. To control swelling. Please note, it should not be too tight or too loose. Elevation. Raise the injured part above the heart level. Its benefits. It decreases swelling. It reduces blood flow to the injured area due to force of gravity. Referral. Refer the injured person to a qualified professional such as a physiotherapist. Its benefits. To get a precise diagnosis. To have a proper treatment. Types of injuries. 1. Strains. It occurs when there is a twist, pull or tear of the muscle or tendon at joint. Its signs and symptoms can be swelling, tenderness, pain, decolorizing of the skin, bruises, difficulty in moving the injured part. Two. Sprains. It occurs when the ligament is stretched beyond its limit and eventually gets torn. Its signs and symptoms can be swelling, tenderness, pain, decolorizing of the skin, bruises, difficulty in moving the injured part. Treatment for sprains and strains. You should sit or lie down and support the injured part. Apply cold compress to reduce pain, swelling and bruise. Wrap the cold compress around the injured area. Secure it to a bandage that is next to the joint. Support and raise the injured part preferably above the heart level. Call for medical help. Check circulation every 10 minutes. Three. Cuts. This is likely to happen after having an impact with a sharp or hard object. Its signs and symptoms are open wound, bleeding, redness or swelling around the wound, pain, irritation at the skin surface. Treatment for cuts. You should 1. Clean the wound and cover it with a sterilized gauze. 2. Raise and support the injured part above the heart level. To control bleeding and minimize the risk of infection. 3. If the cut is deep or bleeding is not stopping, call for medical help. For blisters. It occurs when when the skin rubs against a rough surface. It is superficial in nature. Its signs and symptoms are liquid-filled sac, pain, burning. Treatment for blisters. You should not burst a blister as it increases the risk of infection. In case of burst, do not peel off the dead skin. Clean the area and cover with adhesive dressing. Prevent further rubbing. Five abrasions. It occurs when the skin rubs against a rough surface. It is superficial in nature. Its signs and symptoms can be irritated itchy skin, bleeding, sensitive skin, redness, pain. Treatment for abrasions. First we have to clean the wound. Then we can place a sterile dressing onto it in order to protect the skin. Six. Bruise. It is bleeding beneath the skin due to a blow or fall. Its signs and symptoms are bluish or purple-colored patches, swelling, pain. Treatment for bruise. 1. Raise and support the injured part in a comfortable position. 2. Apply cold compress around the wound in order to reduce blood flow and swelling.